Welcome back Sunbro. We hope you all in great health and great money. Today we are going to talk about a neat and tidy home may indicate OCD. Obsessive compulsive disorder, sometimes known as OCD, is a persistent mental illness in which a person experiences obsessions and uncontrolled urges to engage in a repetitive action. Obsessive is a phrase for someone who worries excessively, while compulsive disorder is a personal disorder that a person may experience if they are too meticulous, organized, and perfectionistic. The usage of the word disorder indicates that the disorder has a noticeable impact on people's daily life. Cleaning under pressure. OCD can be stated to be centered around order. An overwhelming fear of germs or contamination is one of the common indicators or symptoms of OCD. OCD sufferers, however, differ significantly from those who enjoy cleanliness but do not experience excessive fixation. Cleaning the environment makes a person who values cleanliness happy and more productive. While OCD sufferers act in pressured circumstances, people with OCD may focus on things or behaviors that are unrelated to cleaning or organizing specific areas of the home. Additionally, they fear losing control of other things greatly. Other OCD-related symptoms include the following: refuse to allow someone to come over because he thinks his home needs some organization. Organize the stack of books or magazines that has been piling up on the table so that it appears orderly and symmetrical. Additionally, OCD patients frequently check that the can label on their beverage or food is always pointing forward so that it is simple for them to read. Excessively clean the shoes before entering home. Getting upset just because something wasn't put back where it belonged after use. Because of this, many OCD sufferers opt to live alone. Don't self-diagnose OCD even if you have all of the aforementioned symptoms. Instead, go see a psychiatrist for the right kind of care. How to handle those who have OCD illnesses. Some OCD sufferers exhibit the disorder or tolerable signs of the condition. However, it is advised to seek help from a psychiatrist if an OCD sufferer's disturbance is getting worse and beginning to interfere with their everyday activities. Treatment for OCD might involve a combination of medication, mindset and behavior therapy. 1. Thought and behavior therapy. Patients with OCD frequently and routinely undergo exposure and response prevention therapy, or ERP. This therapy involves displaying a circumstance or situation that prompts compulsive behavior in patients suffering from OCD illnesses. The patient is then instructed to resist it. For instance, a doctor or therapist may instruct an OCD patient to wait up to 15 minutes before washing his hands again after the initial wash. The goal of the therapy is for patients with OCD to eventually only need to wash their hands on occasion when it's required. 2. Medicine. Patients with OCD may receive treatment support from doctors in the form of SSRIs, or selective serotonin reuptake inhibitors. This drug is often used as an antidepressant. OCD patients who receive this kind of treatment report fewer problems overall. 3. Domestic support and efforts. Those who are closest to OCD patients and their families do play a critical part in their treatment. Other family members can assist patients in managing their OCD problems while they are at home. For instance, husband can divert an OCD wife from cleaning the house by suggesting she watch TV or engage in other activities. People with OCD can keep practicing resisting their obsessions and compulsions by using the strategies mentioned above. Furthermore, yoga and meditation are two more methods of relaxation that can be utilized to lessen OCD-related stress and anxiety. A person with OCD can still lead a decent life and be productive like most people by receiving appropriate and consistent therapy. The obsessions and compulsions he experiences can also be managed by him in a way that is more constructive. Thanks for watching Sunbro. Please subscribe, like, comment, and share if you find this helpful. Come again to our next meeting Sunbro.